Hi, everybody. We're sitting here with Arthur Moen and Cabrini Loredo, who work on the 988 Travel Response Grant. We're going to talk a little bit about the recent 988 Travel Response Conference that was held at Palo Casino Spa Resort on September 16th. And we're going to get some details from them. Arthur, do you want to introduce yourself and what your role is with the grant?
Yeah, thank you. So my name is Arthur Moen. I'm actually the program director for the 988 Tribal Response Grant here at Indian Health Council.
Awesome. And Cabrini, what do you do for the 988 grant?
Hi, everyone. My name is Cabrini. I am the 988 Community Outreach Worker here at Indian Health Council.
So,
Correct, yeah.
Arthur, as the project director, you want to tell us what the 988 Travel Response Conference is, what it's for, what your program's about?
So it's a very large grant that gives us that opportunity to build that relationship between the community, the tribal leaders, and the tribal police, and also, in a sense, gives us the opportunity to actually build the relationships with the state and the federal and local agencies and stuff, where we're able to combine the two together and work as one to bring that resources to the tribal community and, in a sense, help our community members and stuff while they're in a crisis or just need to be able to speak to somebody. And, and also in a sense, we actually are able to train the state and the local agencies on how to be more culturally sensitive towards the Native community.
Gotcha. And how does the conference support those goals, Cabrini?
So the conference really, I think, helped get 988 out there, Tribal 988 out there to the community. We invited all 9 consortium tribes, and we had people from out of state fly in just to attend. And I think it definitely put us on the map to have people start talking about 988 and why it's important and why it's needed.
And you were expecting, or we were hoping for, what, like 120, 150
was our
people
goal.
was the goal?
Yeah.
We ended up having how many people actually attend?
Right at the moment, we are currently at 221 attendees that we had show up to the conference.
That's incredible.
Yeah, it was remarkable. I mean, we were expecting 150. We had 220 that registered, so we were hoping to at least do the 200 range and stuff, and then to get there in the morning time and and able to just interact with each other, and it was amazing to see the support we got from just the community and also our partners over the state and the federal agencies as well.
Right. So the attendees, that included first responder organizations and various
Tribal law
enforcement, all that was there. But then we also had community members who literally came to the gate that morning and registered that morning, right?
Yeah, I probably would say there were a good amount of the people that were tribal members and community members that just showed up on that day and registered at the event, and it was amazing. It warmed all of our hearts that we're working on this grant to get this resources out to the community and stuff, and we're able to see that they're willing to come out and and learn and and get educated on those resources, so they're able to take it back to their fellow community members and stuff like that. So yeah.
So in addition to the conference where we shared resources, we facilitated discussions with the first responders and the clinicians and the community. We also had a room, the registration room was also an information booth and tabling area. Yeah. Can you tell me a little bit about what was going on in that space?
So the way we set up the conference was in 2 rooms. So when you walked in to register and get your badge, you actually had to go through that room and all 28 tablers that were set up. We had 4 vendors, 4 local community vendors, and we had the rest were informational tables with different programs from around the reservations. Like we had TANF, we had strong-hearted natives, women, and once the attendees were done walking through that room, they had to go into the next room, which was the conference room. So I think that was a really good setup. That way everyone kind of was corralled into seeing all the information, and then next, that's when the conference started in the conference room.
Right. It was a really big event.
Correct.
And integrated care is something we've been talking about here at IHC quite a bit over the last couple of years. And and integrating all of our various departments and our services that we provide to provide a more whole person level of care.
Correct.
How did integration work within this conference?
I think it was an amazing showing of the integrated care that we're trying to promote here at the clinic with all the departments. I mean, we had departments from BH, behavioral health. We had tribal family services that were helping in the conference. We had RSD, and RSD actually had a couple other team members that were speaking in the breakouts. Same with Tribal Family Services. They had members doing speaking in the breakout rooms. And, we had, say the TANF from TFS, they were tabling information. But, on top of that, we had health promotions that were helping with registration and stuff like that. And then, we had marketing. Obviously, they were, running the show and stuff like that, back in the back, behind the scenes and stuff like that. And, we had we had all of our departments that were cohesively working together as one to bring this cause to the community. So I honestly think it was a win when we talk about integrated care in the clinic side.
Awesome. I think across the board, the scope of the event, the quality of speakers and the programming that you guys put together was really well received. And so well received, in fact, that I know you guys got kind of a special invitation from a person who was in attendance. Cabrini, do you want to share what went down with that?
Yeah, so the Deputy Director, Vanessa, who works under James C. Ramos, Assembly Member, the first ever Native American Assembly Member, California lawmaker, was in attendance, and she actually invited us to the inaugural Native American Cultural Heritage Parade in Sacramento happening in November. So we were really honored to receive an invitation for that. We do plan on attending, and we're excited to go and represent the Indian Health Council and our 9 consortium tribes, and it's just very, very special to me to be invited and be able to be working with my community. And now that I don't know, it just feels very full circle. Like I mentioned this in the conference in my speech, but I grew up in this reservation. I grew up in San Pasqual, and to be able to come back and work with Indian Health Council has been very full circle for me. And now I get to go out and into my Native communities and work with other successful Native Americans, and it's just very, very cool and very special to me.
That's awesome. That's a great honor. Congratulations, you guys.
Thank you.
I know how hard you worked on this on behalf of the community and the good work that the 988 Tribal Response Grant is going to do over the next couple of years in the community. So this is the first annual conference, which means we've got more on the books. We're going to get people together again in a good way in another year. What are the key takeaways from this conference that you hope to work on over the next year? What are we going to be talking about a year from now, do you think?
Right.
I think, and for next year's conference, I hope a lot more people know what 988 is. I think next year is going to be focused more on everything we have accomplished since this last year, and what are our next steps with integrating it more in the community and hopefully creating an all-Native call center. Hopefully that's the focus for the next year's conference.
Awesome. Well, thank you for sharing on this, you guys, and thank you for all the work that you're doing on behalf of the community and on behalf of IHC. It was an honor to be a part of the team that helped put this together with you, and I look forward to collaborating more and bringing good services to the people.
Thank you.
Thank you.
Thank you for inviting us.
Of course.